Aortic stenosis. Aortic stenosis is a narrowing of the orifice between the left ventricle and the aorta. The obstruction to the aortic outflow places a pressure load on the left ventricle that results in hypertrophy and failure. Left atrial pressure increases. Pulmonary vascular pressure increases, which may eventually lead to right ventricular failure. May be caused by congenital anomalies, calcification, or rheumatic fever. Aortic insufficiency. Valve flaps fail to completely seal the aortic orifice during diastole and thus permit backflow of blood from the aorta into the left ventricle. The left ventricle increases the force of contraction to maintain an adequate cardiac output, often resulting in hypertrophy. The low aortic diastolic pressure results in decreased coronary artery perfusion. May be caused by rheumatic endocarditis, infective endocarditis, or congenital malformation, Marfan's syndrome, Ehlers-Danlos syndrome, EHLER-DANLOS, Ehlers-Danlos syndrome, systemic lupus erythematosus, or by diseases that cause dilation and tearing of the ascending aorta, syphilitic disease, rheumatoid spondylitis, dissecting aneurysm. Aortic stenosis clinical manifestations: loud, rough systolic murmur over aortic area, often associated with a palpable thrill. In aortic insufficiency, clinical manifestations are high-pitched blowing, decrescendo diastolic murmur audible along the left sternal edge. Low blood pressure, dizziness, syncope, angina, and symptoms of cardiac coronary heart failure, congestive heart failure in aortic stenosis. Fatigue, weakness, dyspnea, cough, orthopnea, nocturnal dyspnea, murmur, and arterial pulsation visible and palpable over precordium and visible in neck. Widened pulse pressure and water hammer, Corrigan's pulse. Corrigan's, Corrigan's pulse. The pulse strikes palpating finger with the quick, sharp stroke and then suddenly collapses in aortic insufficiency. And the medical intervention, antibiotic prophylaxis for endocarditis before invasive procedures, and treatment of heart failure, diuretics, sodium restriction, vasodilators, cardiac glycosides, and are all indicated. Surgical intervention for aortic stenosis or insufficiency: replacement of aortic valve with prosthetic or tissue valves. Balloon valvuloplasty, aortic stenosis also needed. And the nursing assessment in aortic stenosis: auscultate for prominent fourth heart sound and possible paradoxical splitting of second heart sound, suggestive of associated with left ventricular dysfunction. First heart sound is normal. Auscultate for mid diastolic murmur at the base of the head best there and the apex of the heart. Note harsh and rasping quality at the base of the heart and the higher pitch at apex of the heart. Aortic insufficiency: auscultate for soft first heart sound. Place the patient in sitting position, leaning forward. Place diaphragm of stethoscope along left sternal border at the third and fourth intercostal space and then along the right sternal border. Auscultate for a high-pitched diastolic murmur to increase audibility of murmur. Ask the patient to hold breath at the end of deep expiration. Re-auscultate for murmur.